Good afternoon, everyone, and welcome to today's member benefit webinar. My name is Jessica Bailey-Wheaton, and I serve as Vice President and General Counsel at Health Capital Consultants, a healthcare, economic, and financial consulting firm based in St. Louis, Missouri. This bar year, I serve as Chair of the YLD Health Law Committee and as a YLD liaison to the ABA Health Law Section's Membership Committee. Today, I'll be moderating our panel presentation on Drinking from the Fire Hose, Health Law Attorneys on the Front Lines of the Pandemic, which is being co-hosted by both the ABA Health Law Committee, or YLD Health Law Committee, and the ABA Health Law Section. As we all know, it's been a crazy last 12 months, to put it lightly. And while we've seen a lot about how various groups of people and individuals have been coping over the last year, one group I feel I haven't heard from is that of my peers, other young health law attorneys. I think we're in a unique position. Not only is our work and our personal lives changing, but the substance of the work we're doing has been shifting rapidly. And some of us that came out as young attorneys, may or may not have even had a background in health law specifically. So I think that really compounds the uniqueness of our collective experience during this unprecedented time. So to speak to that, we've put together a panel of other young healthcare attorneys who we'll be talking to today to kind of speak about this crazy time we're living in. And specifically in the professional sense. And I imagine that a lot of what they're going to say today and what we're going to talk about is probably going to ring true for a lot of you all in our audience. So please feel free to ask us questions by submitting them in the Q&A box. If you even just have comments or an amen to something somebody says, feel free to also put that in the chat box. We want to hear from you. We want this to be an interactive experience and really be able to talk about this together as best as we can over Zoom. So Tracy is going to be putting up some polling questions here in the first couple of minutes of the presentation so that we can learn a little bit more about you all as our attendees so that we know who we're speaking with and we can tailor our discussion hopefully appropriately. So with us today, we have Nina Kumar, the Vice President and Operations Counsel with Ardent Health Services in Nashville, Tennessee, Nawa Lodin, an associate with Goodwin Procter in New York City, and Hayley Penan, a Deputy Legislative Counsel with the State of California's Office of Legislative Counsel in Sacramento. Of note, and she'll talk about this later in the presentation, Hayley also heads up the ABA Health Law Section's COVID Task Force. Thank you, ladies, so much for giving us of your time today and doing this. So let's dive in. So to start out, I'm going to ask each of you all to give us a little bit of background. Introduce yourselves, provide us with a little bit of your background, your current position, and a brief overview of your practice. Nina, let's start with you.
Well, good afternoon or good morning for those of you behind us in the time zone jump. My name is Nina Kumar. I am a Vice President and Assistant General Counsel for Operations at Ardent Health Services. I am the General Counsel for 2 of Ardent's 5 divisions, our Americas Division and our East Texas Division, which encompasses about 15 hospital facilities. I actually started at Ardent in September of 2019. So I got a little bit of my sea legs before about 6 months in when everything crazy happened. Prior to that, I was a partner in the healthcare regulatory group at Nelson Mullins, Riley and Scarborough. I represented hospitals and physician practices. In my role at Ardent, I consult with our hospitals and our physicians on a day-to-day basis. And prior to that, I was a clerk on the Tennessee Supreme Court for Supreme Court Justice Holly Kirby, and I went to Vanderbilt Law School.
Great, thanks. Nawa, why don't you go ahead and introduce yourself?
Hi, everyone. My name is Nawa Lodin. I'm an associate with Goodwin Procter and our healthcare regulatory team. I have been practicing for 5 years now and have done entirely healthcare regulatory work. It's something I've always been interested in, even when I was in law school. At Goodwin, we represent all sorts of companies from startups to Fortune 500 companies on healthcare regulatory questions. regarding privacy, fraud and abuse issues. And we also advise these companies on transactions, including acquisitions and IPOs. And it's, in my opinion, the most interesting area of law.
Great, thank you. And Hayley, last but not least, please introduce yourself.
Hi, everyone. Good morning and good afternoon. So I am a Deputy Legislative Counsel for the State of California's Office of Legislative Counsel. I'm in the section that focuses primarily on health law issues, as well as criminal law and some other topics. I've been at the Office of Legislative Counsel since July of, what would that be, last year, so a year and a half now. And before that, I was a staff attorney at the National Health Law Program. And prior to that, I was a fellow at the U.S. House of Representatives Ways and Means Health Subcommittee while doing a master's in public health policy. And I went to the University of California, Irvine School of Law. I also, as Jessica mentioned, am the chair for the ABA Health Law Section's COVID-19 Task Force and vice chair for our Public Health and Policy Interest Group.
Great, thank you. As I try to advance the slides, there we go. So let's jump in and talk about how things have changed over the past 12 months or decade or however long it's been at this point. So if you can think back, painful though it may be, I kind of want to explore how everyone's professional life has changed or remained the same during this time. So Nina, let's start with you. Talk us through your professional life and how that has changed at the start of the pandemic and perhaps evolved since then.
Yeah, so I'll start with kind of probably the most basic change that I see. And that is, like many of you, I suspect, I went to work on Monday, March 16th and did not return. And what was funny about that was they had sent an email around saying, if you want to work from home, go ahead and do that. And I initially kind of resisted that idea because I thought I'd be working from home for quite some time. And I went on Monday and things started to get a little dicey. That was when all the social distancing guidelines came out and that kind of stuff. And I realized our office was much bigger than what social distancing guidelines at the time were suggesting. So I made the quick pivot in about 24 hours to work from home. And that was probably the most obvious of changes. And what I would say about that is that everything changed and nothing changed. And what I remember, and what I mean by that is I still had my day-to-day operations counsel duties, which, by the way, was a plenty full portfolio before the pandemic. I had the interesting experience, if you would call it that, of working with our facilities in New Jersey. That's an area that I cover. And for those of you that remember, New Jersey, New York, those areas were kind of the epicenter of the pandemic at the very beginning. So here I was working with facilities in Texas, New Jersey, Idaho, and Kansas. And that's facilities I still work with, and at varying different stages of the pandemic, right? So I had my general kind of operations stuff going on. We were pausing elective procedures at that time, pretty much throughout all our markets. And then I had this whole new body of law that CMS put out, the blanket waivers, and how those affected COVID-19. I learned cool abbreviations like IRF, inpatient rehab facility, SNF, skilled nursing facility. And I learned those things because I realized that we had hospital beds that I had never had to deal with the issue of how you use a hospital bed. And that was something that came up because we had to deal with this surge and we needed beds that were not necessarily appropriate normally were it not for the CMS waivers. I also got to become intimately familiar with all the state regulatory law on these matters. And one thing I tell people all the time is that doctors are not like attorneys. And I say that with love. My father is actually a physician, so they don't answer their cell phones in the hospital. I had one tell me they check their email weekly. Okay. Whereas I feel like we're always like checking our email, answering our phone. So one thing that I had to do is I was taking conference calls at 9, 10 o'clock at night with our doctors in New Jersey, which was simply the time of which they were available to talk. So I kept my regular portfolio and then began sort of delving deep dive into this whole idea of what it meant to be a lawyer during the pandemic, how I could support our doctors in our hospitals, how we could support our patients and communities in the times of a pandemic. And then after that initial sort of surge in the spring, how could we continue to be a COVID hospital where we were needed, yet encourage our patients and community members that it was safe to return to our facility. And one of the biggest issues that we did not deal with initially, one of the great things about being in several states is when the surge happened on the East Coast, we flew a lot of our nurses in where we had paused elective procedures in other markets. Unfortunately, that is not a reality. And so we have dealt with extreme nursing shortages during this time and staffing issues kind of on an unprecedented scale nationwide.
Wow, that's a lot. Nawa, what about you? How have things changed and evolved for you over the past year?
So like Nina said, I also went into the office. I remember taking the train from my apartment to the office in Manhattan. Train was completely empty. Office was maybe a couple people in, and they're like, yeah, you should probably take everything home with you. Did not think, this many months later, I'd still be home. But what I can say is in the beginning months of the pandemic is probably the most I have ever billed as an attorney. Because if you think about logistically, why do corporations, companies, why do they have outside counsel? Why do hospitals, ASCs have outside counsel? Because they need up-to-date information that perhaps their in-house team can't handle at the time, right? So that was everyone, all of our clients trying to figure it out at that time. So everyone was reaching out to their outside counsel, which were the law firms. So it's definitely the busiest, I think, was March, April, May. June, I think we were kind of plateaued, and now it's kind of been the same since June, but definitely the first 3 months were the craziest hours. I mean, God forbid we have another pandemic, but I've been told that this could be a once in a lifetime type of pandemic, and hopefully a once in a lifetime type of hour requirement for healthcare associates at the time. But, I think so much of what we do changed. Nina mentioned elective surgeries were all halted. That gave me a flashback because I completely forgot the drama of trying to figure that out. Reaching out to regulators to understand their executive orders and what exactly is an elective surgery, because that's not actually defined in New York. So that was another piece of information that all of our ASC clients were very worried about, of course. And then some things that are elective eventually could become very dangerous, right? So just trying to understand that in that gray area was very difficult. And as lawyers, we love giving an answer to our clients. And during a pandemic where there's no real rules yet, you can't give a solid answer. So it was also very stressful in coming to terms with not having a true answer. And another part of healthcare law that I had never really done before was bioethics. I drafted visitor policies for many of the hospitals in New York. Can you bring in a visitor depending on your state of COVID? So that was, really painful to think about, people very sick and not being able to have family around them. But something I've never done before. And I also think many others have never worked on before. So I remember taking a bioethics class in law school, and it was so interesting, but it's theory, right? You never think that the theory will come into practice, but it absolutely did in the past few months of the pandemic.
Yeah, that's really great points. Hayley, what about you? Tell us about your experience over the past 12 months.
Yeah, I think the biggest thing for me as well is kind of the mechanical components of it. So the legislature is a very traditional body, right? And before the pandemic, our work was almost all done on tangible paper, right? That went from one office to the next through the process. And we had to very quickly adapt and figure out how to make that digital within a short period. And that also applies to how the legislature itself was trying to figure out how to function in the spring. And that was definitely a challenge. And I think that, on a personal level, with respect to my professional life, it was also hard going from a situation where basically when I was at work, I was working, right? All of my work was at work and I couldn't take it home with me. And then all of a sudden, all of my work is at home. So trying to figure out how to set boundaries that were appropriate and also, make sure that things get done in an efficient way, because everything was starting to take longer in the beginning, shifting systems. And that was definitely a learning curve that I think I've mastered over the last almost year now. And at the same time, I shifted this new role running the COVID-19 task force for the health law section. And that presented its own challenges with, some of what Nina and Nawa were saying, learning whole new bodies of law and figuring out how to package information that could be presented to the health law section membership so that we could all stay up to date about what was going on in this rapidly changing environment. So I think those have evolved into their current state and been interesting learning experiences for me, for sure.
Yeah, absolutely. And I think we've touched on this a little bit, but I want to dive into it a little bit more. And this question is for all of you. Maybe Nawa, if you want to start off answering, what do you think you've learned during this last 12 months, whether it's professionally, personally, et cetera? What can you take away from this? Oh, and Nawa, if you'll go off and mute for us.
Sorry about that. Yes, I think I touched on this a little bit before, but I think that everyone is figuring it out as they go, and that presents a real opportunity, especially for young lawyers. There was no, again, I'm a fifth-year associate. The partners didn't have the answers either, right? We were all trying to figure it out together. So to be on a level playing field like that is a very unique opportunity. I don't think that will come again. When the pandemic first hit, we had a client that was interested in bringing COVID-19 testing into the United States. And at the same time, the regulators were also figuring it out. I don't just mean in a law firm setting for the law students listening. The regulators are also trying to figure it out. I haven't ever really done FDA work, but we had a client that said, hey, we have this test. We want to be able to provide it to people because testing, again, can save lives. How do we bring this into the United States? It was technology from Singapore. I downloaded every regulation I could find about emergency use authorizations, filled out the forms, and then the partner was like, all right, well, you know as much as I do on this topic, go ahead and send it out. Turns out we got the emergency use authorization approval, and that was something I did completely just by reading the forms, reading the regulations, and figuring out, of course, having a partner, oversee everything, but they also didn't know because it's emergency use and it's all new guidelines. It was approved, but then later on the FDA changed different regulations around testing, but it just opened a whole, again, I mentioned bioethics. There's also FDA, which isn't really healthcare law, but in this situation was all hands on deck, right? So I was like, oh, let me try. No one else can figure it out. We'll see what I can do. So I think one of the things I learned is to be flexible. It's the time to be really ambitious. It's the time to try something new. I was obviously really nervous, whether that's imposter syndrome or whatever it was, to submit something to a regulator like FDA on behalf of a client that could really save lives, right? So it was really nerve-wracking, but it was probably one of the biggest accomplishments of my very short career so far. So I think that, for young attorneys interested in healthcare law, I would just emphasize there's so much opportunity in so many different areas of healthcare law during the pandemic.
No, those are some great points. And I think that kind of rings true the lesson we all learn as we become adults, right? That at the end of the day, no one really knows too much of what they're doing. So never feel like you can't step up, you can't say something, you can't try, because everyone else may very well be in the same position.
Definitely. Even the FDA didn't know because they ended up changing the EOA process a couple months after I got that quote unquote authorization. We can't say approval. But yes, even if the regulators were trying to figure it out, and you can't blame them. They don't know. They're figuring it out along the way. So just great opportunity.
Yeah, absolutely. Hayley, what about you? What's a lesson learned during this time?
Yeah, I kind of echo what Nawa said. I think a lot of lessons learned were substantive lessons about this whole new area of law. I kind of was lucky in some ways, having done a master's in public health right after the Ebola crisis. So the idea that a pandemic could happen was something that I wasn't a stranger to before this happened. But it's one thing to think about that from a public health perspective and a policy perspective, and it's very much another to be thinking about it from a legal perspective. So trying to get up to date on all the pertinent issues and again, like I said, kind of figure out ways to essentially teach that to other attorneys, right? So that they can take that into their practices through our work with the task force was a new challenge for me, and was, stressful, but also I think I learned and grew a lot as a person from it.
That's awesome. Nina, what about you?
Well, I think to echo kind of some themes that have already been made, the judge I clerked for always said that if you can ask the question, you can find the answer. And I take a lot of comfort in that. And I think that especially early on in the pandemic, and even now, but early on, there are a lot of things we didn't know. And it wasn't because you're new or young or inexperienced, people just didn't know. And I learned through that process that it was okay not to know, but really the most important thing was to understand where to go to find those answers that you might not know, whether it's conversations with regulators, reading regulation, just knowing where to go to try to get the answer was really just the most important thing and the best way I could help our doctors in our hospitals.
That's a great point. I love that quote from your judge. That is very true. I want to stop real quick and ask a question that actually just came in from the audience, and I'll let any of you all answer this. How have you made time for self-care? And if so, what activities or tips have helped you relieve stress, anxiety, etc.?
So I've actually done more self-care during this time than I've ever done before. And actually last January, so a couple months before the pandemic, I bought a Peloton bike. And I cannot say enough good things about Peloton content. I could do a whole webinar on Peloton. Don't worry, I won't. But for me at home, just even having that time to carve out 30 minutes just to jump on the bike, and then I can jump on a call, or 20 minutes to do a strength class, do a yoga class, even ride for longer when I'm needing to, 45 minutes or an hour. It's been life altering and really a huge self-care thing for me.
My advice is get a pandemic puppy.
Yeah.
I got mine in March.
Nice.
My main source of serotonin.
Yeah, I was thinking what Nina said. I, have had, I would say, a pretty strong exercise and mindfulness practice for a while, but I really had to rely on that strongly during this time. One of the main facets of that has been doing virtual yoga classes. I'm lucky that I was at a yoga studio before this that shifted to all virtual classes and was able to stay on and within the same community. Seeing people on Zoom, I think, really helps you stay motivated and feel connected, which I think is also a really important part of self-care. I've also been using the app Headspace pretty regularly, which I think is really helpful to just set aside 10 minutes of your day to just breathe and focus on, connecting to yourself. I think has really, really helped me.
That's awesome. Those are all really great tips. I think the exercise one is important because in part for those of us who went to the gym before COVID, that was such a change. And I feel with working out, when you interrupt your routine, it's really hard sometimes to get back on and find what works. So no, I think those are some great tips. So next question, and I'll start with Nawa on this one. Is there anything you think could have prepared you for what you've experienced over the past year? Whether it's if you wish you'd had better time management skills, working independently, certain substantive knowledge. Is there anything that, if you could go back, you would change?
I think the biggest thing is I thought everything was an emergency. Every single email was an emergency. Every single phone call was an emergency, which in our minds at that time as healthcare lawyers in the beginning of a pandemic, everything was an emergency. So that added a crazy amount of stress, especially with the hours we were putting in the beginning. And I think kind of coming to terms with not everyone thinks it's an emergency, but it's not. Learning how to triage. I don't know the answer to that question yet. I maybe I've gotten a little bit better and have told partners or clients, like, I'll get back to you at this time. I wanted to answer everything as soon as possible. So I think trying to come up with a system, maybe internally in your team, with the partner you work with or with the client, on how to actually triage, these are the true priority items, and not everything is a priority in this very moment.
Yeah, that's a great tip. And I think something every young lawyer certainly kind of contends with. Hayley, what about you?
Yeah, I think the biggest thing for me has been adjusting to figuring out how to stay organized in a digital space instead of having, everything be in paper and in the office format. So trying to, organize my life and think through all of that has been definitely something that I wish I had been a little more prepared for at the beginning of the pandemic. I will say, I think also thinking about the ways in which politics have played a role in how everything has gone down. I'm kind of glad that I did have some political experience before the pandemic, so my role is very much non-political and nonpartisan now. But with the task force that I've been running, we have volunteers from all states across the country, and the ways that different states and different people have been looking at the pandemic and shutdowns and what things have meant and how businesses and healthcare providers should be approaching things varies from state to state in some cases. And so trying to navigate that space, I'm glad that I had the experiences that I've had with thinking through politics and different perspectives and negotiating amongst individuals.
Yeah, that's a great point. I think this time, if nothing else, has really showed how different all of the different states in our country are and how different people approach the same issue. Nina, what about you? Anything that could have prepared you or helped prepare you for all the madness?
So I've always sort of thought that, and it's given me comfort, that life is not really random. Okay, that you are a collection of experiences and things that have prepared you, for this moment that you find yourself in. And I was a college athlete, a two-sport college athlete, actually. So I actually was one of the only people I know that thought I had more time in law school because I wasn't having to work out like 5 and 6 hours a day. So I've always had great time management to the point that it was to my detriment at times in a law firm setting because I was very efficient with my time, and they measured you based on billable hours. So that preparation kind of that I'd had my entire life, I think was really key during all of this. The other thing I would say is that I think we as lawyers are trained problem solvers and fixers. And one of the things I learned with our healthcare providers in-house during this time is sometimes they just need someone to listen. Like sometimes it's not totally about you fixing every single problem because you can't, and you can't put that on yourself. But sometimes just a simple, like, I hear you, I understand, thank you for all you're doing on the front lines. Is there anything we can do to make this easier type of thing? Really goes a long way sort of in terms of morale if you're, in a company or something like that, and reminds us all that we're all human. And I think that reminder is very important during this time when we are so sharply divided politically. I have an interesting situation. My father's a physician. He's also a state legislator. And so seeing sort of the intersection of health and policy in a rural state, during this time, yet working in other states kind of gave me a lot of insight as to what people who aren't living this on a day-to-day basis are really thinking. Law and the practice of law can be a real fishbowl, right? And we sort of all think that people see it or are dealing with what we're dealing with. And there's a lot of people out there just trying to live their life very inconvenienced, by all of this. And I think that's a really important reminder too, when we're going through this process.
All right, and we've talked about it a little bit, but federal, state, local laws and regulations have changed rapidly, to put it lightly, over the past year in an attempt to respond to this pandemic, and that's presented a myriad of challenges. So I'm interested in hearing from each of you all some of the ways in which you've kept abreast of these changing healthcare regulations. What do you read? What do you listen to? What websites do you visit to try and keep up? Hayley, why don't you start for us?
Yeah, so I think the biggest source for me has been keeping abreast of what's going on with the federal government. So, monitoring what's coming out of CMS's website, ASTR Tracy, CDC, FDA, all of the government guidance, and even just, news briefings and things like that are great places to start for what's happening. I think also getting on listservs for nonprofits that focus on health law issues, like the Network for Public Health Law, and the Center for Connected Health Policy and other similarly situated organizations has been a really important tool. And I think, at the beginning of the pandemic, my partner and I got a subscription to New York Times and checking, just like making sure to stay tuned into that and other local news every day has been important. And, as part of the COVID-19 task force, we've been trying to collect this information, and we have put together a web page that has, links to a lot of the guidance and critical resources and firm pages that are compiling up-to-date information. And I will share a link to that in the chat so y'all can tune in.
Awesome. Thanks for that. Yeah, I think that's super helpful. And, that's the reason we paid money to be part of the ABAs, to get those kind of benefits. Nina, what about you? How are you staying on top of everything?
So I think one thing that you can face, probably more so working from home during a pandemic, is an isolated feeling. My cat is like low-key my best friend. So I kind of understand that sentiment. We actually at my work have a Friday legal department meeting where all of the division heads, so we have 3 division general counsels, our big general counsel, and then several subject general counsels, come together and kind of talk about what we're seeing and what we're dealing with. And especially at the start of the pandemic, it was really valuable. Our hospital in New Mexico had the first COVID drive-up testing site in the country. And so setting that up and hearing about my colleagues' experiences setting that up, or them hearing about, some of the waivers we were having to get in New Jersey and sort of the state regulators we were working with, that kind of stuff, and that sort of exchange of ideas was really like emotionally good, I think, as well as very substantive, and impactful. And I know for me, I felt like I was reading so much. I was like, oh my God, I should, but I just can't read another thing. So, that sort of talking and interfacing with people. And, when you are on information overload, getting like a panel of people almost together to kind of help you distill through it has been really, really key for me. And, kind of hearing about the issues that they're facing too. I think that's really important. And I think when you're in the office, that sort of community and that collaboration happens much more organically. I think out of the office, it can definitely still be done, but I think you have to be more deliberative, mindful, and intentional about how you go about that.
Yeah, that's great. Nawa, what about you? How are you keeping up?
Nina, you just reminded me of when the pandemic first hit. I was on daily calls with the GCs of many New York City hospitals. I'm not sure if they're happening daily anymore, but we were on daily calls. Everyone, all the GCs were working together in Manhattan and Brooklyn to figure it out. And, obviously, I think this is one time more than any others that you realize how differently states operate, specifically with telehealth, remote prescribing, scope of practice issues. It's very difficult to answer questions for all 50 states. We have many clients that want to provide services via telehealth in all 50 states. I have an app and I want to be able to prescribe a controlled substance by a nurse practitioner. And the clients always say, why isn't there just like a national law? Like, why do we have to get analysis on every single state? So I actually was just working on a survey for every single state, and then also including all the COVID waivers in each state, because every state has different registration processes. As long as you're licensed in another state, that works, or you might need to go through some sort of registration process here. So it really does vary everywhere. So I don't think that there's a practical way other than checking all 50 states for those types of issues. But one way I do recommend, of course, I follow what the ABA COVID task force is doing that Hayley mentioned, but I also recommend joining your state bar's COVID task force. I know that New York has one, I know that California has one, and Connecticut, but I'm sure many of the states have it. But so the state bar associations will fill you in on what's happening there. Another very practical tip, and I learned this along the way, many of our hospital clients were trying to get a hold of PPE. Nina mentioned the nurse shortage. We also had PPE shortage. We couldn't get the masks. We couldn't get the gloves. Couldn't get the gowns. So I was working to figure out how to bring in. I learned so much technology about the different types of masks, more than I never thought in my life I would learn about, the different types of latex used in gloves and what's appropriate in different settings. So anyways, I would attend weekly FDA town halls on very specific types of PPE. So they might still be going on. I think the issue has relatively been solved, but at the height of the pandemic, I went to a weekly meeting on the gloves so I could learn it, and I could advise clients on, yes, you can import those gloves if it complies with these different issues from Singapore or from the Philippines or from China. There was a lot of drama with the KN95 mask, which is different than the N95 masks. Another situation in which the regulators, the FDA, kind of changed their position a few times. So the FDA town halls are definitely something I would recommend. Very specific, but pro tip, if you want to learn more about what's acceptable COVID testing, you also learn about the practice settings. So originally you could only get the testing done in a healthcare provider setting. Now they're doing it in your car and in stadiums, and they're sending vaccines to pharmacies. So the site where you can get these things is changing as well. So I learned a lot of that from these town halls that are free, and that, of course, you just log on to the webinar like it is here, and you can sign up and participate. And you can also ask questions, very specific questions. I had several very specific questions for the regulators, and they would respond. And you could use that advice from the FDA regulators to advise your client, and that was as enforceable as law, essentially.
Wow, that's great. So kind of building off what Nawa was saying, we've all learned a lot substantively and otherwise during the pandemic. So Nina, knowing what you know now, what would you tell your March 2020 self? Any sage advice you wish you could go back and give?
Well, I will confess, I don't know about anybody else. I think this has gone on longer than I anticipated it would. I did not, anticipate working from home. So, it's a marathon. It's definitely not a sprint. I do think that there's light at the end of the tunnel, but I think that for that to be on a widespread scale, we're still months, candidly, away from a significant number of the population being vaccinated such that we can go back, to what we kind of identified with as a more regular existence before this. So yeah, I would definitely sort of say that it is a long road. I think that also learning to appreciate the small wins and the small sort of victories in the situation is really important and will sustain you. We had somebody in one of our facilities who's on a vent for 93 days that has come off and was able to go home. And that was a big deal. Because statistically, once you're put on the vent and then the longer you're there, the less and less likely you are to come off. So I think celebrating those wins and seeing the human face behind the pandemic is really, really important, to kind of keep going. And I would also say when you are working in the field, seeing friends and people on social media that are going about living their normal life is very damaging, or at least it was to me. It was frankly really upsetting. So a steady diet, and I've never been one, like I always have had different opinions and could deal with people with different opinions. And it was never that, but just the blatant disregard, was really tough for me. So I definitely learned to kind of limit my sort of social media consumption, because the pandemic will be over. And I would probably like to be friends with these people, once that's over. I just can't really, their attitude right now is a little troubling. So, taking care of you and kind of the mental health aspect. And I think that we've seen more collaboration in this time period, even with our competitor hospitals and competitor facilities. It's a global issue, and it's going to require a global solution, no matter what the individual states do. And sort of approaching things with that kind of collaborative intent, I think, is something significant too.
Yeah, absolutely. Hayley, what about you? What would you tell your March 2020 self?
I think if I could tell my March 2020 self anything, it would be just take a breath. I think that, some of the presenters have mentioned, the sense of urgency in the beginning with everything going on was really strong. And I think it took some time to really quell that on a personal anxiety level, right? Also on a personal level, I bought a house in March. So that needs a lot of work. And the idea that I had to get everything done with that and get renovations planned and do all of this in a pandemic, and also be adapting to this new role at the ABA, and all of that all at once, I think got a bit overwhelming for a time. And In retrospect, like everything got done, everything was fine, like life goes on, right? But I think in the moment, it would have helped to just take a breath.
Yeah. And sometimes as lawyers, we're not necessarily trained to do that. I think we're trained to attack and get done no matter what. And so I get that. Nawa, what about you? What would you tell March 2020, Nawa?
End your lease in Manhattan sooner. Practically speaking, I think being conscious of the fact that things are going to change. So even when you think you had a small win, that small win could change in a week. And again, I think we mentioned this as lawyers, we always want to have an answer. We want to counsel. We're not just lawyers, we're counselors, right? So you want to counsel your client to say, this is the answer. This is how you do it. And that it doesn't really happen right now, or at least was not happening back in March. It definitely wasn't happening in March. I keep remembering this elective surgery situation where we didn't have an answer to the elective surgery. What could they presume with these types of surgeries? So coming to terms with like, look, we don't know, nobody knows, and then answering what's the risk level. That's, which I also hate that question when clients ask, which is their number one question, right? Like, what is the risk? We don't know right now. We don't know how much government enforcement there's going to be if you bring this mask from China and it's not properly vetted. We don't know the risk right now if they're going to go in and seize these gloves. We don't know if they're going to come in and ensure that all these COVID testing sites are complying with CLIA regulations. I have only heard of a handful of these situations happening, but I imagine that could change soon. So the uncertainty gives me a lot of anxiety, but coming to terms with that's probably going to be at least for another year, there's going to be a lot of uncertainty.
Yeah, that's a great point. And I think that it's almost hard at this point to remember how uncertain everything was back in March. Things were changing by the day, by the hour. What you heard one day was no longer true the next. And so that's almost, I don't know, maybe it's just my own compartmentalization trying to stay away from that. But yeah, it's a great point that just people don't know. And we sometimes have to be okay with that. So let's talk about the time we've all been fantasizing about, life after COVID-19. I hear it's going to happen one of these days. So how, if at all, do you all think your practice will change going forward? What things that maybe seem temporary back in March do you think will become permanent? And Nina, let's start with you. What do you think?
Well, I'm an eternal optimist. So let's start with what I hope for. And one of the things that a lot of us in the industry hope for is that around COVID-19, there were some relaxing of some regulations in the healthcare world that a lot of us hope will remain in. And one of the biggest examples is telehealth. So before the pandemic, there was not a good reimbursement rate for telehealth. And that was especially acute and felt in rural areas where there were questions of access to care. And CMS has relaxed and allowed the telehealth requirements so that doctors can be reimbursed for telehealth at the same ways that they are reimbursed for inpatient visits. And there are a whole lot of us that are really hopeful that that will remain part of our professional lives going forward, because it is a huge thing for hospitals. It's a huge thing for our patients, especially in our rural communities. And it really does improve access to care. I mean, we went overnight from virtually a handful of telehealth visits to televisits by the hundreds of thousands. And I think it's gone well. I think the industry has managed it well. And a lot of us are going to be lobbying hard for to the telehealth requirements to continue to operate in the way they have been during the pandemic. So I'm optimistic and hopeful that that will be the case. One thing that, on a personal level for me in the practice of law that has changed is I'm much, much more integrated into many sort of more hospital side conversations, business side conversations. And that's been great for me actually, because one of the biggest reasons I wanted to go in-house after making partner at Nelson Mullins was I felt like all I did was put out my clients' fires. And I didn't see the business, which I put out a lot of fires now, trust me, but I didn't see the business side of things. And I would always wonder, like, what happened with that? And then they'd call you for the next crisis. And so really to be a valued sort of partner of the executive team has been a great change for me and something that I definitely hope and foresee continuing.
Great. Nawa, what about you? What do you think might become permanent going forward? How do you think your practice will change?
Yeah, definitely echo what Nina said. There's been a lot of relaxation of many of the laws. I remember advising clients on HIPAA issues when they were using telehealth, and the regulators put out a great list of like, look, we're going to relax some of the technical administrative requirements that are needed for communicating with patients. So they're like, you can use FaceTime, you can use Facebook Messenger. I remember reading that. I was like, whoa, but that increases accessibility for patients that may not have a Zoom account, because I think Zoom you may have to pay for, Skype the same. So Facebook Messenger, I remember reading, I was like, wow, that is absolutely free. So many people probably use that more than these other apps. I had never even heard of Zoom before the pandemic. So for HHS to come out and say, you can use Jabber, you can use WhatsApp, and you can use Facebook Messenger to speak to your healthcare provider, I thought that was great, you know. And I think now the burden is on Facebook and those companies to ensure that they can have the technical safeguard requirements. I think it should be more on the big companies rather than the providers. So we'll see what happens with that. But hopefully those changes stay. Hopefully some of the scope of practice changes stay. I know there's a big drama in the country is what, and I mentioned this earlier, what nurse practitioners can do. Nurse practitioners can provide great primary care support, among other things. And during the pandemic, in many states, they were able to do a lot more than they were usually. So I know that community is definitely lobbying for more practice autonomy. And then one area that I'm not sure is going to change, and there's opinions on both sides because there is an opioid epidemic in the United States, is the DEA regulations on prescribing controlled substances. And I have many clients that are mental health apps, for example, and they want to prescribe depression medication or Adderall or something like that. So some states, in addition to DEA registration, also have state registrations. They may have lifted that in the states, but could we see an uptick in opioid addiction because some of those restrictions have been lifted, right? So I don't know what's going to happen with that area, but I'm going to be closely watching that because it is a public health issue.
Yeah, absolutely. All right, about the last 12 minutes or so we have left, I want to talk about, maybe some career opportunities and challenges, not just for you all specifically, but for our audience, those other young attorneys, the law students, et cetera. So Nina, starting with you, do you think that the pandemic has created any professional or career opportunities for either you specifically or young lawyers in general?
I think that the pandemic has allowed us to become more well-rounded attorneys. That being said, I really hope we're not accumulating knowledge that we're going to have to use again. I really, really do hope that this is a once in a lifetime event, but I think it has allowed us to become more well-rounded and have a better understanding of what our doctors and our hospitals do and why they do it and the challenges they face and some of the regulatory burdens that are on them, to your point, that have been lifted during COVID. So I think it's given us a body of knowledge. I'm hesitant to hope, I really hope that this pandemic specific knowledge is not something we have to use again, but I think the sort of general understanding of the workings of our clients and the challenges they face and the patient care and the access to the PPE. And I mean, to Nawa's point about the PPE, we're going along fine. We're cruising. We had great. We really had no trouble until the leading glove manufacturer had to shut down because of a COVID outbreak at their facility. And then we were on a glove hunt that went on. And so I think just some messages for us about diversifying our supply chain, because we really thought we had been good in that situation. And those types of things are sort of important. Like I said, I do hope that the pandemic specific knowledge is just a once in a lifetime thing, for sure.
Yeah, that's great. Hayley, anything to add? Do you think there's any opportunities that this has created for young lawyers?
I think it's definitely created opportunities for young lawyers. I think, like was mentioned earlier in the presentation, there have been it's basically created a more even playing field in a lot of respects, right? And allowed for young lawyers to step in and learn about these areas that everybody didn't know very much about back in March, and be the go-to person for that issue within their relative organization or like within professional organization, which I think has been, really a really great opportunity for young lawyers. And for me personally, I got the opportunity to run this COVID-19 task force, which has been a great opportunity professionally, and a great learning opportunity. And I think that, when March occurred and it was all hands on deck, it really gave a lot of folks the opportunity to step up and prove themselves and be like, hey, I can do this, especially those that are within a few years of their career after having left law school. So I think that, those opportunities are continuing and will continue, at least through the end of the pandemic and hopefully after.
Yeah. And Nawa, I think you were the one that brought up the point earlier. It's very well taken about the opportunities that you had as a result. Do you see that translating to other young lawyers, or do you think that will continue at the end of all of this?
Definitely, just because I think the regulators are changing everything as they go, as they're figuring everything out. But at the same time, I think pandemic, as we know, is terrible, but a lot of businesses pivoted their work, maybe even many businesses, I know for a fact, many businesses were created through the pandemic, whether that's providing COVID testing, whether that's manufacturing PPE, whatever that is. There's a lot of new job opportunities. In New York, I remember Governor Cuomo had offered like a free teletherapy session or with some startup that was New York based. And I actually know that one of those startups has legal internships for law students that are interested in learning more about telehealth and mental health. And so I think a lot of that's just one isolated example in New York. And I think that is probably everywhere now. So there are a lot more, I think, job opportunities right now.
Yeah, that's a great point. And I think it leads to, what we talk about a lot as healthcare young attorneys is those non-traditional careers, right? It's not always just the law firm. There are so many type of in-house type of positions, not just with hospitals and providers, but now with these telemedicine or mobile app companies, because most of them want to practice across state lines, and they need someone to figure that out for them. So I think that's a really great point, that it's probably more diverse employers, in fact, out there these days than there was a year ago.
Yep.
So Nina, on the flip side, we've talked about before this webinar about how there are some parallels perhaps with the Great Recession, where we came out of law school when there weren't a lot of jobs or opportunities, especially for young lawyers. What kind of parallels do you think we see with that?
So I graduated law school in 2010, which for those of you on the call, 2009 and 2010 were not the greatest times economically. A lot of summer programs got canceled or scaled back, and a lot of job offers wound up being rescinded during that time. So far, I feel like the COVID impact has been more industry specific. I think the hospitality industry, the restaurant industry, those types of industries face inordinate challenges during this time. I'm not seeing the same level of recession in the legal industry, that we saw 10 years ago, which is a really good thing. But what I will say is that anytime there's a challenge, there's always an opportunity, and the cream will rise to the top. And if you are earnest, if you're resourceful, if you're finding ways to connect and make connections and make yourself valuable to someone, your legal career, will soar. I do admit that I think it is, when you're a younger lawyer, particularly challenging to work from home. And that's something we were actually touching on with summer programs at firms that are remote. But it creates opportunity, and it creates an opportunity for a targeted conversation, a targeted ability to reach out to someone that you're interested in, or whose career path you're hoping to follow. And in my experience, I think people right now are enjoying safe interaction, so that those opportunities and experiences are well received from the folks that you're reaching out to.
Yeah, I think that's the great point. Don't let this stop you from trying to make those connections and talk to people whose field you maybe hope to go into when you graduate. Nawa and Hayley, do you have any advice for similar situated young lawyers, or maybe these law students that will be graduating here in a couple months? What advice do you have for them coming out of school and entering the workforce at this time?
Get ready for a wild ride.
What about you, Hayley?
I think one of the most important lessons I've learned is the importance of volunteering, and raising your hand and saying like, yes, I'll do that, even if it seems scary or it seems like something that you don't feel fully prepared for. There are tons of resources out there, both like online and in the mentor capacity, that can help you along the way. But in this time, and I think generally, the more senior you get up the food chain in the legal community, the less time folks have to dedicate to those kinds of activities. And so I think, seeing a lot of young lawyers and law students step up over the last year, at least through the task force that I've been running, has been really, really helpful and provided, I think, a platform for them to develop some more expertise and to make connections within the legal community. And I think that has been very valuable for a lot of folks.
Yeah, that's great. And I think that's something I didn't learn until I was in the profession for a few years, is that, people don't always have the time. So they're willing to help if someone will put in the legwork, raise their hand and say, I'll figure this out, help figure this out, and take the lead. I think that's really valuable to people, even if you feel that you shouldn't raise your hand or you don't know enough or you haven't been around long enough. I've never heard anyone say no to a young lawyer offering to help. So we got about 4 minutes left. If anyone in the audience has a question that you want me to ask, please drop it in the question and answer box. And while we're waiting around on any of those lingering questions, I want to ask each of our panelists for any concluding thoughts. Maybe there's something we haven't touched on today that you think is worth talking about or mentioning. And Nina, I'll start with you. Any concluding thoughts?
Yes, I think this is a unique time. I think it's a historic time. I think that there are some positive things. We don't ever want anyone to be sick. I certainly don't, but there are some things that, from a healthcare regulatory perspective, that are good that could come from this. And I think that there's also probably an appropriate time for some self-reflection. A lot of us, me included, were very, very busy people and really running around at a pretty high and unsustainable rate. And sort of this forced pullback at times, I don't think is necessarily a bad thing. And I think some thoughts about what we want to take from this time as we go forward is a good thing, probably for all of us to do.
Absolutely. Hayley, what about you? Any concluding thoughts?
I think I would just say that in following up on my last comment, if you are a young lawyer or a law student, or even later in your career and you're interested in getting involved in COVID-19 related issues, please reach out to me. I'm happy to have more contributions on the task force that for the ABA Health Law section, and I think it can be an interesting opportunity, and we'd love to have anyone on board.
Great, thanks. And last but not least, Nawa, any concluding thoughts, and maybe specifically, since you are in New York City and you're dealing with a lot of new companies, anywhere for our young attorneys or law students to look for those open positions and those opportunities?
Definitely. One, I would say find the startups, just kind of Google around to see what the new startups are that are doing healthcare work. Blind email them, just directly email them, say I'm a healthcare law student and I want to learn more and I want to contribute my time. Do you have, because they're startups, many of them may not even have internships yet. So this is an opportunity for you to be like, I'll be your first intern. I'll shadow your GC or whatever is going on, and I can do that. But there are websites like builtinnyc.com that list specific Manhattan-based startups and the work that they do, and I think they list jobs there as well. So I kind of check there. but definitely make a list of like, I really love the work that this startup is doing. I'm going to reach out to them on LinkedIn. I've messaged many people on LinkedIn and sent them emails to kind of get the roles and the experiences that I want. So don't be shy about doing that. And in terms of concluding thoughts, I would say this is really everyone's time to shine. Like kickback law, Stark, HIPAA is always going to be here, right? And it's hard to like push yourself and kind of stick out. This is the time to be like, I'm going to learn about this emergency use authorization so I can bring this COVID test, or I'm going to learn about these gloves or this PPE, or the bioethics for who gets the vaccines first, or who the visitors that can come into the hospital. That's your time to shine. And then we can go back to regular life where it's just the fraud and abuse and privacy issues. So this is the time for everyone to really shine.
I think that's great. And thank you, ladies, so much. This has really been fascinating. It's been fun to hear about all of your different perspectives. I think there's so many things, unique experiences and yet shared experiences at the same time. So thank you so much for sharing your experiences today and providing your insight. And thank you for all the attendees that joined us. If you all have any follow-up questions, don't hesitate to reach out to me or any of the rest of the panelists on LinkedIn. I think I speak for all of us when I said we'd be happy to help in any way we can. So thank you again for joining in, and have a great rest of your week.
Thanks.
Thank you.
Thanks, everyone.